payers can and appropriately do limit how involved they will be in the audit, often through their administrative agreements with the plans. But just because they've limited how much they're willing to do for the administrative fees that you've paid them does not mean that the fiduciary and the plan have to accept those limits as applying to them as well. You still have every right, especially if you're a self-funded plan, some would say a responsibility, to do audits that you think are necessary, not just what you have, quote unquote, permission from the payer to look at. So what are you auditing? This is also important, not only why are you auditing, but what are you auditing? Well, again, as you can see in this slide, one of the more common areas is people want to audit their claims because they're concerned about payments. So they've seen the claim payments go up, the plan costs rise, or they've heard about certain overpayments or certain issues that are causing them to wonder how the payments are being handled. So by far, historically, the most common audits have been claim audits because that's where the dollars are. Now we're seeing a lot more emphasis on auditing people, who's covered, who's eligible. So eligibility and enrollment audits. In our book of business at Health Decisions, if you'd asked me what are you auditing, what are your clients auditing 15 years ago, it all would have been almost all claim audits. Now it's probably 50-50 claim and enrollment, with the curve favoring the enrollment audits, if you will, and with a big impetus, sort of the retro burners kicking in because of the Affordable Care Act.